A continuation on factors that contribute to health, 3805 6b. Another factor is the political legal factor. Every aspect of government and the economy has the potential to affect health and health equity. Finance, education, housing, employment, transportation, and health are just six of many. While health may not be the main aim of policies in these sectors, they have strong bearing on health and health equity. Political coherence is crucial. Different government departments' policies must complement rather than contradict each other in relation to health equity. If you listen to the news, you see what's happening in our effort to reach that debt reduction. For example, trade policies that actively encourages the production, trade, and consumption of food high in fats and sugars to the detriment of fruit and vegetable production is contradictory to health policies. Unfortunately, obesity is on the rise because of it. Obesity is becoming a real public health challenge in transitioning countries, as it already is in high-income nations. Obesity prevention requires approaches that ensure a sustainable, adequate, and nutritious food supply, a habitat that lends itself to easy uptake of healthier food, participation in physical activity, and a family, educational, and work environment that positively reinforces healthy living. Very little of this action sits within the capabilities of responsibilities of the health sector. Positive advances have been made, however. For example, there's bans on advertisements for foods high in fats, sugars, and salts during TV aimed at children. However, there's a significant challenge remains. To engage with the multiple sectors outside health in areas such as trade, agriculture, employment, and education, if we really want to readdress this global epidemic. Both the federal and state agencies, such as Social Security and Medicaid programs, classify individuals by their race or ethnicity to obtain useful information about health and health care. Access to medical care by low-income immigrant minorities can be hindered by legal barriers to public insurance programs. In the United States, federal law bars states from providing Medicaid coverage to immigrants who have been in the country less than 5 years. In the educational level, is achieved is related to utilization of health care and reported health status. According to the report by the National Centers for Health Statistics, the education of a responsible adult, that is, head of the family, contributes to the frequency of the type of health care used. Those families whose head had completed less than 12 years of education reported fair to poor health status. Higher rates of disability days are higher and hospitalization utilization as well. Those families with responsible adults who possess 16 or more years of education, there's a higher percent utilization of primary services and lower rates for health characteristics were reported. The median family income rose with each higher level of education for men and women in each race and ethnic group. As far as occupations are concerned, the majority of the uninsured are in working families. Low-wage workers are at greater risk of being uninsured, as are unskilled laborers, service workers, and those employed in small businesses. According to the Florida Health Insurance Study, about 65% of the uninsured employed Floridians have employers who do not offer health insurance. About 15% have employers who offer health insurance, but they are not eligible for coverage. And about 9% report that their employer offers the insurance, but they are ineligible, but they just can't afford the premiums. The rate of uninsured for employees who work for businesses with less than 10 employees is 3 times as great as for firms with 50 to 100% employees, and more than twice the rate of their counterparts with 25 to 50 employees. As far as ethnicity and race in immigration is concerned, they say that there's different ethnic group and race experience different rates of health care access due, in part to health coverage. While whites make up the majority of the uninsured in the United States, minorities are disproportionately affected by the lack of health insurance. Hispanics are more than twice as likely as white non-Hispanics to lack health insurance and comprise nearly 25% of Florida's uninsured. African Americans are more likely to be uninsured than white non-Hispanics. Even at higher income levels, minorities are at a much greater risk of being uninsured, according to the Kaiser Commission report on health insurance coverage in America. Immigrant status and cultural considerations affect health care coverage and utilization among immigrant populations as well. According to the National Survey of American Families, 37% of the low-income non-citizen adults reported not having a usual source of health care in comparison to 19% of low-income citizens.